My chest is so tight. There are not a lot of critiques for ER, but that's one of them. Like, put the baby the right way.
Nice.
Remember that?
Well, you know, you could shoot me.
Oh, here's this prick anesthesiologist. I am not okay after that. This one's exciting. We are doing a reaction to an episode of a show I have been obsessed with since I was 17 years old back in... Of course, that would be the original accurate medical series, ER. This one, I was obsessed. I watched it every single week, and this was back before there was things like PVR. So you actually had to be physically present. You had to knock out that time on your calendar and be like, I'm sorry, I can't hang out because I am watching the next episode of ER. You couldn't just rewind. So very, very excited. This is, of course, the episode where Carol has her twins. She's, of course, pregnant with Doug's twins, Doug, the original McSteamy. Let's get into it. I gotta hydrate. I'm so excited.
Carol,
okay, Carol is there.
Don't push. Betadine?
No.
Doppler sounds good.
Dr. Carter. We are as in love with him right now in 2025 as we were back in 1999. Look at that guy. I would let him be my doctor anytime. All right, here we go. Okay, so we're checking in on baby.
It's over. The contraction's over.
Oh, I love that she waited till the contraction was over.
Check your cervix, girl. Relax.
Okay, checking your cervix.
But you'll remember this Thanksgiving, huh?
Yeah.
It's a distressed face. What's happening? Don't tell me there's a foot. Nope. What?
Carrie, what is it?
Carrie.
You're at 10 centimeters, Carol.
What?
Fully effaced, 2+ station. Halay, open and out, beep.
So fully dilated, 10 centimeters dilated, fully effaced, 100% effaced. That cervix is paper thin. +2, baby has come right down in that pelvis, is coming down. Oh, she is ready.
I don't want to
Surprised
deliver
she's not
down
pushy.
here. I don't want to deliver in the ER.
Facts.
Do you
I
want
used
to
to work
deliver
here
in the
and
elevator?
also
How
wouldn't
can I
want
be
to
10 centimeters?
in
Probably
ER.
been contracting all day.
Oh, God.
Call Pete.
Some people can
Let's
contract all day and
rotate
not
the
know.
gurney and give her some
Oh no, poor Carol.
Carrie, I'll just hold it. Okay, I promise I won't push. I
Oh.
won't push.
Let's make a deal.
I can tell you this. I used to want to be her. Like, I wanted the same scrubs. She used to wear the pink scrubs with like the black shirt and the coat and the pink scrubs. And I was like, I want to be Carol. Carol Hathaway, was it? Carol? I want to be Carol when I grow up. Yeah.
We'll deliver this one down here, and you can have the next one upstairs.
Oh, I like that they're actually talking about how there is a space between twins, because that
I'm
is
gonna need that
accurate.
fetal monitor. We could do the second one
Look
on the
at Carter.
ultrasound.
Get out of here, Carter.
Oh,
It's okay, Carol. Don't worry about a thing. Give me some steroid
little
blood.
Carter,
baby face.
get out of here.
John, I got it. Why don't you see if Dr. Kovac needs help?
I've
Ooh,
delivered
Kovac
babies
could also be
before.
my
Not
doctor.
this one.
Dr. Weaver.
Oh,
She knows you. She doesn't feel
that's true.
comfortable.
You gotta feel
It's actually
safe and
green.
comfortable.
Yeah, he's not delivering. Get out.
Oh,
Okay.
Dr. Green is her birth coach, yes.
Okay, let's break the bed down.
Contraction subsiding.
Okay, Carol, I want you to push hard for 10.
Okay, well, Carol, actually, maybe wait for a
Come on,
contraction.
come on.
Come on,
10,
Weaver. Okay, that's fine. We're going for it. Let's go.
7,
Count
6.
People say that a lot in labor. Count faster.
Okay, just relax.
out?
Not yet. Next contraction. Good job.
Carol, almost there.
Did you plan a natural childbirth?
Hell no.
Okay, where's Pete?
Carol's my girl.
Somebody get Cleo in here.
Dr. Weaver?
Oh.
D-cells on twin A?
Oh,
What?
D-cells twin
No,
A,
let me
so
see.
twin A being the twin that's
Okay,
closest
get the
to the
OB
birth
call
canal,
and
so
have
baby
Ellen
that's going to come
bring
up
down a
first.
vacuum extraction set.
Vacuum? No.
Carol, look at me, honey. It's just for safety.
Aw.
The first baby's heart rate is down to 90, but we're okay over 80, all right?
What a calming presence. She wasn't my favorite character, but like that was...
Let's go with the scalp
Chill.
electrode.
Oh, no, do you have to?
It just gives me more accurate monitoring, okay?
This...
Rest up.
Pause. It would be pretty rare to put on a scalp electrode when you're pushing a baby out already crowning, because at that point in time, like, you just, like, it doesn't really matter what the scalp electrode's saying. Like, you just need, that baby needs to get out, like, sooner than later, especially if you're picking up a D-cell. And if you're picking up a D-cell with an external monitor that has a reliable, like, you can hear that it's a reliable waveform, like, there's probably no need for a scalp electrode, because they do come with risks, right? It is an invasive procedure. It is a screw on baby's head. It's not a sticker. It's not a little patch. It's actually a screw. Very accurate, so we do use it when we need to, but I don't really know if it's, I don't really think it would be necessary right now, but that's all
Okay,
right.
you rest up. In 2 minutes, you're going to push this baby out.
Oh, I love Carol.
Five.
Okay, here we go.
How close is she?
She's there.
Fetal rate is 85.
I don't remember
The
that other
hands
lady.
out, bulb suction. Don't
Bulb
push.
suction.
Carol,
We used to
don't
do bulb
push.
suction.
Don't push, honey.
Mouth then nose. We don't do that
Is
anymore.
the cord around its neck?
We don't do suctioning unless absolutely necessary.
Not anymore.
Okay, so nuchal cord, but again, this can be very common.
All right.
She just
we go.
released it, reduced it. Okay, sounds like we're waiting to deliver shoulders, heads out, cords off the neck. Anytime she's ready, she can push.
Oh.
Oh. Let's see, did she birth a toddler? As most TV shows? Yeah. Oh, I mean, that's not terrible. That's...
To your daughter.
Oh, daughter. I guess she didn't know what she was having. I mean, that's not as bad as some of the toddlers I've seen birth for newborns. Look at how alert that baby is.
Let's check the presentation at Twin Peaks.
Okay, so first baby is out. She's checking to see if baby B is...
Like about 6 pounds.
6 pounds. It's a bit more than 6 pounds,
That's a
Chloe.
good size for
But
a
yeah, she's
twin.
checking to see if baby B is head down or feet down.
Carol, take a good look at her.
Okay, so they're clamping the cord. Oh, cutting the cord. Hello, got that? Oh, it's actually a really realistic looking umbilical cord. Oh, I love Carol.
Have you picked out a name yet?
Tess. I think I'm gonna name her Tess.
Oh my god, that music is so nostalgic.
Welcome to the world, Tess.
Oh. All right, so we're going up to labor and delivery in between. Oh, it's Abby. I think, doesn't she become a doctor later on?
35164.
Oh, I like this.
35164.
That we're
all set.
actually identifying
Say
baby and
bye-bye,
tagging baby,
honey.
so we do that so we make sure
Bye,
that
honey.
everybody's baby is everybody's baby.
Thanks, Carrie.
I would think that baby abductions are far
Are the
less common now
contractions still
because
strong?
babies usually stay with,
Well, they're a little
the
spaced
mom?
out, but yeah.
but
We'll
always
do
good.
another ultrasound.
Contractions
but
have
if the
spaced out a
baby's
little
hard, it
bit.
could take a while.
Very
Is
normal
Dr.
with twins.
McLucas on her way?
Yeah, we're working on
Oh,
Do you want an epidural?
Mark.
I can still have one.
it. Absolutely.
Oh,
I
well,
love
if I
this.
wasn't sure before, I am now.
I love that they're offering her epidural. Like, that's amazing.
You're gonna miss the
They aren't just
party.
like, you already had a baby, let's go. Push the second
Oh,
baby out.
God.
I'll call the
I love
anesthesiologist.
that. Okay, so she's gonna have her
Girl.
epidural. Her birth coach,
girl.
Mark, is here.
Troublemaker already?
Oh god, I love him.
Hanging in there?
It's brutal, Mark.
I don't
One
think
down,
there was a
one to
doctor that I didn't like on the show except for that short, cranky one that got his arm lopped off by the helicopter. Remember that?
Well, you know, you could shoot me.
Yeah, if it comes to that.
You have
Oh.
to use a straight cath.
The epidural
Okay, so
numbs your bladder.
pause. True, like we do epidurals and then we do a catheter, and that is because often you can't feel the urge to pee, and if you do feel the urge to pee, often you can't quite empty your bladder all the way, and we want an empty bladder. A couple of reasons. One is it's going to help your labor progress. You don't have a big bladder in the way of your baby coming down. But really importantly, after you have your baby, the more empty your bladder can be, the better, because then it is not in the way of the uterus, giving it all of that opportunity to clamp and contract down to control your postpartum bleeding. So if we ever do run into a postpartum hemorrhage, one of the first things we will do is insert a Foley catheter to get that bladder out of the way. So I'm not sure why they're doing it before the epidural. That seems cruel and unnecessary. We usually wait till the epidural is in and functioning well. So you just have somebody go pee beforehand, and then you do the epidural, and then you give them some time, and then you just feel pressure and touch instead of actually the burning. Because I can tell you, after having a catheter put in all 4 times I had my baby after, I did feel that catheter go in, and it was not lovely. So Abby, -2 points for Abby here, because we could wait.
Sorry.
Anyway.
We do it for everybody. No catheter, no epidural.
No catheter, no
A
epidural.
small price to pay, Carol.
It's not your bladder.
That's not.
Are we doing this?
Oh,
Carol?
anesthesiologist
Yes.
a little crusty.
Right.
Are we doing this?
All set.
Okay.
Okay, Carol, you have to sit up.
Oh, can't we do it on my side?
No, it's better upright when you're pregnant.
I'm a nurse. Tell me
Get
why.
a clear shot at the intravertebral space.
Yeah, you don't want him fishing around. Okay.
I actually don't like to tell people that I'm a nurse when I am a
Better get
patient.
it right the first
I
time.
don't like to wave that around for anybody.
if the patient cooperates.
Oh,
Mark, is
this
it?
anesthesiologist
Could
is
you grab her
crusty
on the
as
shoulder?
sin.
Okay,
Ugh.
Carol, lean into us.
He's like upsetting spaghetti just from living.
And you'll feel
Okay.
a little
So
prick.
first step, this guy is a little prick.
Carol,
First step is freezing,
Carol, it's you.
and then after that it should just feel like pressure.
Mark. I had no idea. Congratulations.
It's not his
Oh,
baby,
he's
they're
my
Doug's
Lamaze
babies. Come on, anybody who knows
How
Carol
are we
knows
doing?
they're Doug's
High and
babies.
intact, 6 centimeters.
6 centimeters.
It's all right,
So
you
I was
shrink
gonna say
back down
cervix shrunk
between
back down in
deliveries.
between. So baby, once baby comes down on that cervix,
You need
it'll
some
just kind of go
local?
poof.
Oh, no, contraction.
Oh,
Just
Carol.
hold on, Carol. You're doing
One of
great.
the hardest parts of an epidural
Carol,
is holding
Dr.
still if you're
McLucas is in
contracting.
Wichita. She asked me to cover her practice over Thanksgiving. Is that all right?
I gotta lie down.
No, no,
That can
Carol,
happen
he's in the
too,
middle
though,
of
where
it
you
right
are
now.
in a
have to
group
hold
of
still.
providers,
No, I can't.
and whatever provider is on covers that service. So you may not actually see your provider
Oh, it hurts.
that you were seeing in the
Mark.
office.
I know.
Oh, Carol.
I mean, it really hurts.
I know.
Oh,
Hang in there.
You feel so
How you
helpless.
feeling?
I'm in love with epidural, man.
Some people call him an anesthesiologist.
Do you know the epidural man?
Anybody else you want me to call?
No, not yet.
Oh, she's so pretty.
Are you sure?
I just want to get through this first.
Oh, what's that?
What's wrong?
I can't actually tell on the
Just
monitor.
lost the signal.
Oh,
Where'd
okay.
it go?
Lost the signal, so that maybe baby moved, and then you just got to move the ultrasound transducer. I'm not sure.
Sandra, could you call Dr.
Mark.
Coburn and bring over the ultrasound?
Mark looks
Right
like he's holding
there.
the. Oh,
Got it.
so now the heart rate is up top.
It's above the umbilicus.
What does that mean?
Baby could be
Sometimes with breech
rotating.
babies we find it up
It's fine.
high.
Heart rate's 140.
Heart rate's great.
Do we have an
140.
OR, Claire? I'll see.
Oh,
Wait, I don't need a C-section, do I?
No, not necessarily, but if the baby turns breech, we'll have to labor you in the OR.
fair. Where I work, we actually labor all twins in the OR.
just a precaution,
Just a
Carol.
precaution, as Mark says, but each set is different.
How are we doing?
Oh, Mark's all in
We'll
his
move it
scrubbies.
right after this contraction. Baby's in lotus position.
Lotus position. That sounds fancy. Let us all learn together what lotus position means. I'm picturing like a white lotus position.
Uh-oh.
What is it?
I think my water just
Oh.
broke again.
Okay.
Sure did.
All right.
Nice and
So
clear.
we want to make sure we have that monitor on
All right,
baby
we'll
when the
clean
water
you up.
breaks. Oh,
What?
Fetal heart rate's in the 90s.
just in case there's a D
I have to
cell.
check you.
Okay.
But we're good till 80, right?
Just relax.
So we want to make sure
Carol,
everything's
I have to
okay
check
down
you
below.
again.
Looking
are you
for
looking for?
Hold
cord
on, I have to wait till
prolapse.
this contraction finishes.
Please tell me it's not a cord prolapse.
75.
75, that's low.
Damn. She's got a prolapse cord.
no.
Prolapse?
Yeah, the cord gets
Oh, no, I don't. Okay, my first concern is if Abby did a cervical check, what she would feel in there if the cord had prolapsed. So that means that the cord has come down in front of the head and then the head has come down on top, essentially like a garden hose and you kink it, cutting off flow, right? So it's obviously an obstetrical emergency because now your baby does not have flow through the umbilical cord at all. But one of the first things that they teach you as a labor and delivery nurse is if you ever feel a cord prolapse, which will feel like kind of like a rubbery pulsating mass, you never take your hand back out of that cervix. Because essentially what you want to do is you want to work almost like if your car gets a flat tire and you have the jack and you bring that car up, that's kind of what you want to do with your fingers. You want to use your fingers to keep the presenting part, which is likely a head or a foot or whatever it may be, keep that presenting part off of the cord so that the flow can go through the cords. Abby, -2 again. It's okay, because she becomes a doctor, so this maybe is not her jam. But anyway, keep your hands in.
Push out before the baby.
Cutting off
Yeah.
the oxygen?
Stat page Coburn.
Cord
the
prolapse,
OR,
obstetrical
please.
emergency, like
fetal
stat
heart rate,
C-section.
65. We have to get this
65,
baby
someone
out.
put their hands in!
Only 6 centimeters.
All right, we'll have to
Put your
crash
hands in, put your
C-section.
hands in!
The OR is not clear yet.
We don't care, we're
We're
coming.
going.
Oh, okay.
I'm keeping the baby off
So there
its
you go.
cord.
What? This can't
So
be
yeah, so
happening.
now
This
she'll
isn't
ride the
happening.
stretcher with Carol. Oh, poor Carol.
Mark, don't let this happen.
Oh my god, oh my god.
Is the baby hypoxic?
We're okay.
What's the heart rate?
We're not on a monitor.
What
Poor
happened?
Carol, what's the heart
Fetal
rate?
heart rate was 65.
I'm surprised
scrub in, Abby.
because it's a medical show, because it's accurate. They were actually saying you're not on monitor, but if this was an inaccurate medical show, they would have been like, it's
Need
65!
10 seconds for her to scrub in. Take over, Sandra.
Okay, everybody, on my count, nice and easy.
Oh,
One,
poor Carol.
2, 3.
Somebody get your...
Get your hand
Yes.
on that cord.
Mark, you
get
gotta
your-
save the baby.
We will.
No, promise me.
I promise.
No!
Okay.
I'm like so...
Let's prep her fast. Okay, where's anesthesia?
But I love Mark so much.
Get anesthesia down here now.
There's no time. She had an epidural. Keep 100 mics of
Okay.
fentanyl.
In real life, very likely, somebody with a cord prolapse, even though they had an epidural and they needed a crash C-section, it is very fast. And so most times what they will do is they will put the person to sleep so that they can very quickly get to baby without worrying about whether or not mom is feeling it. Because one of the worst things, well, I could imagine would be the stress of blowing into the OR with a cord prolapse, not knowing how your baby is doing, and then feeling people cutting or feeling people pulling. But they're gonna just go for it, and I'm hoping that Carol's epidural is...
Okay, I'll monitor her vitals.
I'll monitor her vitals. Look at Mark go! Oh my god, I love him.
Gloves now.
Oh my god, Carol.
Okay, mom's BP, 118
Hey,
over
blood pressure's
84,
good.
pulse 102, satting 98 on room air.
Nasal oxygen.
I'm on it.
Here we go.
God.
1 minute for skin
Okay,
to baby.
1 minute.
Scalpel.
Go. So also accurate that they're still
There's
actually
skin.
like gowning Abby up
Mark the
while they
time.
start the process. They're like, we don't have time to wait. Like, get gowned up and get here.
Stretch. Come on, pull.
I'm pulling.
So we're working on peds.
They're on their way.
So we want these here. Oh, okay, they're actually using a bladder blade. I like that. We call it a Balfour.
Uterine
Okay,
incision.
uterine incision. So they've gone through the layers to the
Okay.
uterus.
And another stretch.
Stretch. Okay,
Pediatrician's
another
here.
stretch.
Mark, what's happening?
See the baby.
Okay.
Blue towel.
Ah, looks like a girl.
Oh wow, this is actually like quite
Is she
realistic
okay?
looking.
Hold on.
Oh wow!
Shoulder.
That legit looks like... Okay, I'm going to link the link to this on YouTube in the description. I can't put it on the screen or they will be like, yeah, it's no good for us because there's, you know, blood in it. But go and see this scene because it actually looks a lot... Oh! It looks a lot like an actual C-section, and then I look back at the screen and they put the baby in the warmer the wrong way. Oh, so close. So close to like the perfect C-section. Okay, when a baby goes into the warmer for the team to help them, which this baby is flat looking, like it's not really responsive, not moving, not crying, so we need to get stimulating and help this baby out. But when you put a baby in the warmer, generally speaking, you put them with the head to the end of the bed because the person at the end of the warmer is going to be the respiratory therapist. They're going to be in control of the airway and the breathing. So they need baby's head so that they can get respirating or ventilating that baby for them. So there are not a lot of critiques for ER, but that's one of them. Like, put the baby the right way. I do like how baby is in the room, still the wrong way. Okay, so now she's bleeding.
Don't worry.
Mark, what's the APGAR?
5-minute APGAR is more predictable.
True, 5-minute APGAR is predictable. More predictable. Oh!
5-minute
Holy Moses, look at that. Now you have a baby who appears to be, 3 or 4 months old, looking much better. Very pink. Very pink. So excellent. So they did some NRP, some resuscitation, stimulating, maybe some respiratory support, and baby has come around. Very oftentimes a baby that comes out kind of flat like that, if you give them respiratory support, they will come around. It's usually respiratory.
5-minute APGAR is 8, Carol.
APGAR's 8.
Can I see her?
So cute.
Hold on, we got some active bleeding
Uh-oh.
here. What's her pressure?
No.
100/60.
Okay, blood pressure's going down. No, Carol.
What took you so
Nope,
long?
They
don't do
just
this.
paged me.
Well,
Oh, here's this
delivered
prick
5 minutes ago.
anesthesiologist.
Profuse bleeding. Uterus is still
Oh,
boggy.
no. So we have a
How much
soft
Pitocin
uterus
has
that's
she
bleeding.
had?
40 units in.
So she's
Another
had
0.2
Pitocin.
Methogen.
Now they're giving
I am.
more
I'll be
medication
looking
to
through
stop
my
the hemorrhage.
endometrial.
She's going to give it right in the uterus, right where it needs to go.
Sponge stick. Check another pressure.
Oh my god.
Oh no, Carol.
Bleeding out.
It always
Hey, you hear
looks
the heart
like more
rate
than there
starting
is.
to get higher?
How are we doing?
Oh my god.
Pressure's down 80/40.
All right, let's pump in some saline. I'll put in another
Oh
line.
my god, he's so helpful.
I want to see my baby.
You will.
We need
Carol.
more lines.
Slow
We need
while.
blood products. We need
Take her to the
fluids.
nursery.
Baby, that 4-month-old baby is going to a
Okay, she
nursery.
needs blood. Typhus thoughts for 4.
Okay,
Oh my god.
3 liters are up.
Hemabate.
Hemabate, another medication for bleeding, but also has a side effect of making you poop, just so you're aware.
have 10 minutes.
Oh my god.
Open a
Oh
hysterectomy
no.
tray.
Oh, hold on, are we there yet?
Carol, your uterus is atonic. It's not firming up, and you're losing a lot of blood in spite of all the medication we're giving you.
Don't do a hysterectomy.
We may not have a choice.
Don't, please.
What else can we do?
Uterus is still boggy. It's another 500 cc's of blood loss.
Okay, Povey.
There must be something short of a hysterectomy.
Yes, losing the patient.
She doesn't want it. She's a nurse. She understands the risk. Respect her
He's
decision.
advocating for her.
O'Leary stitch, Ovicral.
ONEG is up and ready.
Oh god, my chest is so tight. I need a mint break. My chest is tight.
Gave us a bit of a scare, but you toughed it out.
She's so sweet. Look at that postpartum room. Look at that phone.
Yeah, you still have your uterus.
Oh, I'm so glad.
You're up.
Oh, there's
How you
Abby.
feeling?
Oh, groggy.
Any pain?
Actually, no.
Oh.
The first time today.
Brilliant.
Drugs. Enjoy them while they last.
Which are good, which are bad.
I wouldn't repeat this outside of this room, but
Also from the 90s, I
you owe
believe.
your friend here your future children.
Oh,
You know, they both came out so well. You gotta think about doing it again.
Yeah, I'm gonna get right on that.
I'll be right back.
okay. So Mark has to go because he has a family emergency.
Mark?
Oh,
Thank you.
You did good, Mom.
Dr. Mark Green needs to hang out with Dr. Robbie from the pit now. Like that Dr. Mark Green and that Noah Wiley hang out.
Okay, wait till she opens her mouth
I love this.
really wide.
Breastfeeding.
That's it. Yeah, make sure her mouth covers the whole areola.
It's a great tip too.
Yeah, see her little jaw moving?
Oh, she's a barracuda.
She's a natural.
Oh.
And you listen for the swallowing.
Also good tips.
Dear?
You probably wouldn't hear the swallowing on a newborn baby, because you have colostrum. Your colostrum hasn't transitioned to mature milk, but you would definitely hear the sucks. I love that they are encouraging this early breastfeeding. It's great for anybody who is wanting to breastfeed their baby, but especially for C-sections and twins. The sooner that you can sort of initiate that breastfeeding, the better it's going to be for your breastfeeding journey, because we do know that with C-sections, sometimes we see that delay in that transition from colostrum to more mature milk. So the sooner we can get those babies on and touching the breast and licking and smelling and sucking at the nipples, the better that's going to be for the breastfeeding journey. So I love that. Abby, you know what? Abby's back up. Like, you can give her plus 10 for this, so she's in the positive now.
You were very brave.
I don't know about that.
Oh, trust me. Good night.
I want to hug
Good night.
Carol.
Happy Thanksgiving.
Happy Thanksgiving.
There's that music again. Gets me every time. Now she's all by herself with twins. Just her and the girls. Oh. She just had a C-section. She's all alone. She's got her 2 girls. Doug doesn't know. Mark had to leave. God, I am not okay after that. I am not okay. And it can feel so isolating as a new mom, especially with twins and no partner. I know it's a show, but damn it. It was the show. Okay. How did you like that? Was that a good one? Anyway, it was absolutely one of my favorite shows. Love ER. If you want me to do more ER episodes, let me know. If you want me to move into more, recent bad medical shows that are far less accurate than ER, Grey's Anatomy, Good Doctor, let me know that as well. If you like this one, give it a thumbs up. Consider subscribing. We can definitely do more of this stuff. I will see you in the next video. Bye. Dr. Green, call me. Call me. Love that guy. So good. So good.